Stretch lats, prone, lateral, sideline, or supine. Oftentimes, prone is easiest. Supine, sometimes breast tissue gets in the way. Sideline can be quite a lot of weight if you're already in sideline. If you're not using the sideline for anything else, you may as well leave them prone. So today we're just doing pin and stretch and going to resist doing anything else. I just want to assess where actual lats are tightest. Of course they go into the giant thoracolumbar aponeurosis, but the easiest place to actually grab the muscle is right here. One thing about a lats pin and stretch, and pull on the muscle much more than just pushing as hard as you can into the rib cage. So there's definitely some nice restrictions here. And so I'm going to pull the arm up. And so my resistance, I'm pushing in towards the body just enough to grab the muscle, but I'm really grabbing the muscle in an inferior direction, so my hands are going in opposite directions from each other. So just enough pressure in to engage the muscle, and then there's a lot of pressure down. For the hand that's moving the arm, oftentimes I find it nice. First of all, you're going to want to supportively move the arm like it wants to move in a circle, not like straight lines like we're robots. So you want to supportively get the arm at the elbow and the wrist, come off the table. And I find the easiest place to hold the pin and stretch is right around the elbow, just above the elbow, just below the elbow. I usually stand around the corner of the table. Depending on how tall you are and this length of your arms, you might need to stand a little further towards their feet or a little further towards their head. And I'm going to first make sure I have a good pin of the tissue. And you see I automatically take it inferiorly. I don't just jam it in. I grab it as if it was MFR. I can use a bigger or smaller position of my hand grab, depending on how much tissue I'm trying to engage. I might be grabbing one tighter specific spot or a whole big part of the pattern. It's already releasing a lot, so I better stop palpating.
I have another side.
Okay, good.
Do you prefer the crossover hands?
I do, because watch this. Once it moves, it won't be crossed. Make sure you pin it well first. When you have it pinned and you're pressing counter pressure inferiorly, you're going to start moving the arm. You're going to feel the stretch between the two, which, if you're stretching the tissue well, will feel like quite a bit of pressure that you're having to use in a stretching way between your two hands.
So for the test, when you say to be at a 6 or 7, you ask the client what the pressure is before you start moving and as you're moving the arm?
You have a hand mark now. You don't need to get at a 7 intensity to engage the tissue, but just an intensity of the stretch so that they feel like it's a good stretch. So it's a slightly different scale than a pain scale, but a good, I feel the stretch well. So here what we want to do so we don't waste our time and stretch randomly is to reassess, see what has released, what has not released. Sometimes you will find now that a bigger part is soft. This whole part is softer now. Sometimes what you'll find is specific parts of the muscle, like bands, that are tight. Sometimes what you'll find is that you need to be deeper, and sometimes you'll find both. You might even have to be more inferior or more superior. There's a nice tight area right here. It's a specific band, so I can use a smaller tool to engage it. But I'm still engaging it in an MFR sort of a way where I'm not just pressing into her rib cage, but I've got that tight muscle, I've grabbed it, and I'm going to make it travel down. So it's almost like a pin and stretch already, but when I move the arm, it's going to intensify it. And how's the intensity? I'm using a pretty small tool because it's a tighter, smaller band, but that small tool could look different. It could be my thumb, it could be knuckles, it could be my elbow. And then I'm slowing down anytime I meet a resistance point. And if you lose it, just go back to the beginning. Wow, that's a lot softer. I don't know if you can see that or not visually. This spot right here is way happier. And now the tightness is just up here. So I'm going to move up the pattern a little bit. Get a tool that you can travel with. In other words, when you start moving the arm, you can still engage. Now I am at this point on a very specific tight band, so I could at this point check in on pressure, which will feel more accurately on the 1 to 10 scale than if I was on a general part of the muscle, just pressing. So, Michelle, how's the intensity? Okay. One of the tricks is that you may be engaging the fascia well at the beginning, but try to picture what angle will help you continue to do that as you move the arm. And sometimes you'll have to kind of reset yourself if you find that as you move the arm you can't hold the pin as well. And this one I think I'm going to need to get lower and use my thumb on this angle so that I can take her arm farther. It started off engaged well, and then as I started taking the arm farther, it was moving. You can even use the back of your knuckles. Okay. And stretch. Oh, sorry, Michelle. And the intensity? Can you see how the redness traveled up the whole stretch? Sometimes you'll take all the way the arm all the way down and forward. Sometimes you'll take it more forward. Actually, more forward feels more stretchy. Intensity? 7. So play with the different angle of the arm too. Sometimes down feels amazing. In this case, it felt like more up, and forward really stretched it better. As far as the test, that was 3 effective stretches. In real practice, if you had more time, you might even occasionally do more than 3 to get every part of the pattern. So you'd reassess. And hers had some very specific deep patterns we went to after the first general one. But a lot of times you'll have bigger sheets of fascia that, so instead of diving deep to specific patterns, your second and third time might still be broad, but just moving where you grab a little bit. So let's say your first time was right here, your second time might be right here. Sometimes you might even use more of a pincer grasp to get the part of the tissue that's upset. I find that position I was standing in very effective. I use that position almost all the time. but you can definitely play with different angles to have your feet and which arm to go where.
Is that considered MFR that you're doing now?
Yeah, that was MFR. When you repin, you always want to keep the arm down, get the pin where you want it, and then move the arm. Always play with what angle the arm is actually going up on so that you feel the maximum stretch. So if I always randomly abduct, I'm not going to get as good of a stretch as if I sometimes abduct with a little bit of protraction, a little bit of retraction, a little bit of elevation. Very much have to make sure my pressure is inferior to grab that tissue because I'm pretty deep, so I don't want to push on her ribs too hard. Intensity? Is it too ribby? The other little thing about this is sometimes it's easy to accidentally pinch their skin a little bit, especially with the hand that's on the arm. So be careful how your support hand is, that it's not like twisting or pinching. Ease out of it, reassess. That's the idea. Do you want to see any more angles or anything?
Trevor, were you holding my arm with your left hand?
Yes. You could try other ways, but I always find that way, kind of for me, opens up easiest. Got enough angles? Questions on that one? Okay, you can stop.